Right. Hello. That was 40 minutes. That 40 minutes flew by, actually.
Yes, went by pretty quickly. You have host, Doctor.
Right. Okay. Are you all seeing this again?
Yes, I am.
Right. Okay. Could I? Yes. What I was saying is, was it a don't call names? Was it a male GP who saw you and said to stop it?
Yes, it was.
Right. So that's my point. They all well and good for men, and we have quite a number of male doctors. We have quite a number of male gynecologists to look at women and say, yes, do things naturally. Yeah, don't worry with that. But they have no clue, right? What you're experiencing. And certainly, if you're suffering in silence and trying to cope with all of this, it's all well and good for a man to say, yes, that's fine. That's like saying, oh yeah, you want to leave one thing. I hit my finger with a hammer the other day. I'm sure that pain was worse. I think that we have to move away from that sort of thing, right? So if it is, my dear, a specialist who determined that this was a safe option, you started it and you saw an improvement, felt an improvement, right? It's something that is being monitored. You have to have your blood pressure checked periodically. You have to have your mammograms, etc. once you're over 40. Once that is in place and you're feeling better, I think it's a decent option, right, to continue. Because put it this way, if it is you revert back to everything you were experiencing that had you life miserable, that prompted you to go to a doctor in the first place, then you need to basically decide for yourself which is the better advice. Does that make sense?
Yes, thank you.
Okay. Right. Yes. So I'm carrying on a little bit. We'll try to finish up. Tibolone now, when I was talking about loss of libido, because I know that this is something that bothers quite a lot of women. This Livial was one of the things that we did, that we started using in the UK back then when we actually stopped and moved away from testosterone, right? And the benefit of this, it was a synthetic drug that had estrogenic activity. So it helped from the menopause point of view. It had a progesterone effect as well. So it balanced and could be used with women with the womb intact. But it also had testosterone properties. It was metabolized and it gave a little bit of testosterone, which helped with libido. So this in particular, for women like, I can't remember who told me they had a hysterectomy. This is what was one of the things we started more or less right away, because it gave everything back without increasing the risk and stuff, but it also helped a lot with the sex lives of women without having to use the testosterone that was dangerous. And unfortunately, this is something that has never been in Trinidad, right? So these are things, this is why we have to kind of lobby or raise awareness or find ways and means, because a lot of the people who make the decisions, unfortunately, with regards to our formulary and stuff, are a bunch of men sitting down in a boardroom, none of whom have ever had a hot flush before in their life. So they don't factor that in. So I think a big part of what has to happen now is in creating this awareness is that we have to fix all of these little things to give more choices. I don't know, I haven't come across anybody down here who has this. What happens is when you take these tablets, you get you get a dose of estrogen, right? But as you get older, right, and you need some estrogen, you can get it in the form of a patch. And a lot of women avail of this abroad and stuff, both in the US and Canada, UK, etc. And it's just a patch that goes on. It lasts up to a week in some cases 2 weeks. And if you look at it, Emerald is the brand there, but one of them has both estradiol, which is the estrogen, and they have noethisterone, which is a progesterone. So if you have your uterus, you take the Everel Conti, which is continuous. And then if it is that you've had a hysterectomy done and you no longer have your uterus, then this one just has the estradiol. So just like the tablets, the patches come like this as well. So
Are you sharing your screen? Sorry.
Yeah, I was now going to say that. Yeah.
Sorry, my dear, I think I had it on my own.
Yeah, there we go. We're up.
Are you here?
Yep, seeing it now.
Yeah, so that was the Leveil, that's the Tibolone I was talking about. This is what the HRT patch looks like. This one has 24 patches, right? This one you have to use more or less every day. And they have other ones that last basically about 3 to 5 days, depending. This one is the one I was saying that if you look at it, the ingredients are 1 estrogen and 1 progesterone here. So if you have a uterus, you go on the patch. And the patch we usually use for women later on in life, meaning if you're going through the transition in your mid-40s to 50s, when the acute sort of hot flushes, sweats, and you're feeling generally miserable, the tablets are better. But if you want to continue using it later on and you're fit, healthy, no issues with blood pressure, everything is good. Usually from 55 towards 60, we used to go on to the patch. Yeah. So this was a better option for the ones who are later on, who are still wanting the HRT, because in the UK, we had a lot of women who wanted to stay on it and didn't want to stop and refused to stop, right? So we just gave them a lesser dose to sort of minimize the risk. Right. So it was as simple as that. You know, you put on a patch, it lasts for a week, right? And then you take it and you change it and you had all the benefits and stuff. If you wanted to continue over 60, we didn't want the tablets anymore. We changed to the patches. Again, unfortunately, I haven't been able to find patches here. Nobody's really interested in bringing in anything like this, so I think we'll have to try to do it ourselves. On the same issue with regards to vaginal dryness and painful intercourse and stuff, I do get this one to come in. And it's an estrogen cream that basically helps the dry tissues in the vagina. So it for the want of a better analogy, it makes things down there like when you were 20 years old again. So it is very, very beneficial in the sense that any sort of painful intercourse or any problems with, dryness and stuff, this is what helps quite a lot. I have quite a number of women who are on it. Several of them have pessaries and they use this as well. So this is something fairly good to take. And because it's absorbed in very small amounts, it doesn't carry the risk that you get with the tablets and stuff. So this is fairly safe to take, over a long-term sort of period. So this is something that I usually recommend for the women with not having issues with regards to being naughty. Right, I'll touch briefly on this, and this should be my last slide. The big sort of thing is, and one of the women alluded to it, is the risk of breast cancer. And I think this sort of infographic sort of puts it best. Now, 1 in every 7 women walking about, so that's about 15%, right, has a risk of developing breast cancer. So if you have 7 friends, 1 of you all are going to get it. It is as high as that, right? And what happens is, irrelevant of what you do, right? Whether you take anything, whatever you eat, whatever, the baseline risk, right, is about 23 cases. But this is the UK population. I'm fairly sure we don't do very good stats. I'm fairly sure we are a lot higher than that because our diet is a lot worse, right, than in the UK. So on the background, right, out of every 1,000 women, about 23 cases there is diagnosed on that. But if you look at this, right, and if you're looking at lifestyle risk factors, if you were overweight, right, or obese, and that's your BMI is equal or greater than 30, you could work out your BMI, use the calculators, then you actually double your risk of breast cancer. That's not taking anything or taking any tablets or doing anything different. The mere fact that you're overweight, statistically, you are doubling your risk of breast cancer, right? So that means you have probably coming close to 50 cases. Now, remember I spoke about, I showed you that picture with somebody who smokes and stuff. Smoking is horrible. Alcohol is extremely bad for you. There's not one single benefit to alcohol, right? This thing in the 80s where you drink your wine because they have antioxidants under the grape skin, all of that has been thrown out. Alcohol destroys cells, every single cell in your body, from brain cells to liver cells. And this is, people will find this very bizarre. If you drink 2 or more units of alcohol per day, right? And a day is probably two units. If you drink a little bit of rum, that's a unit, right? You increase your risk of breast cancer. And there are women who will drink wine every day, every other day, that sort of thing, right? Not realizing that that in fact is actually increasing your risk of breast cancer, aside from the fact that you're overweight. And look at this then. So there was a study done in 2002. It was called the Women's Health Initiative. It was combined with another one called the Million Women Study. But what they picked up is that if the baseline rate was 23 per thousand, 4 more cases would occur over a 5-year period. So the risk overall is small. So the problem is that if you're overweight, right, and you have a couple of drinks a week, that alone increases your risk by 29 people will get more, whether, you know, without touching HRT. So there was a lot of confusion and chaos where a lot of women came off HRT because they published this without telling anybody about this. And also the cohort of women they used were women over 60s, but you are applying it to 45-year-olds, which you couldn't do. So only now the medical profession is trying to recoup some of that because so many women are struggling and suffering basically, right? 3 cases. So if you smoke, it's almost the same as if you took HRT in terms of increasing your risk of breast cancer. But here's what is also very interesting. If this caused an increase in breast cancer, overweight, drinking, right, smoking, etc., if you actually exercise 2.5 hours a week, right? So if 3 days or 4 days, you spend half an hour, you decrease the risk of breast cancer, right? So that by 7 women. From that, and what was interesting from these studies as well, is that if you want the estrogen only one, that was the Premarin I showed you, right? Your risk actually fell. It was the combined one with the progesterone that carried a slightly increased risk. So when I sit and counsel my patients, you put this on the table because if they tell me basically their mom, 2 of their aunts and their sister had breast cancer, I'm not going to have a discussion with you about HRT. That's an absolute contraindication. I will talk about phytoestrogens, and I have other things that I can offer you for your bones and stuff, but we stay away from the estrogen. If you tell me it is just your grandmother, right, who is a second-degree relative, then we can look at this as an option, right? So again, it's individualization of care. Right, so what happens next? This is my last slide. In the UK.
Quick one.
Hmm?
Quick one. Does this apply to other forms of cancer like cervical and uterine cancers? No.
No. This is purely breast because there's a direct correlation between estrogen and breast cancer because you have cells that have receptors on them to estrogen, and that is what triggers the change. Cervical cancer is almost treated like an infection. It's HPV, all right? That could be a whole different talk. We could talk about that. But that is a totally different thing. This just applies because estrogen has a direct correlation with breast cancer. And there's a lot of scaremongering and stuff. And when the media gets hold of little things, they make it a big thing. And a lot of women get very scared and say, I'm going to stop, and they suffer in silence. There's a lot of things, you know, that is sensationalized when it shouldn't be, all right? Right. In the UK, if you go on right now, you will see if you go to Birmingham, they have 2 cafes that they're talking about menopause. A lot of women groups like yourself with the Facebook chat, they're getting together and discussing these things. It's about raising awareness, but it's also about sharing experiences. And some of the women today, you know, they did that. I came across something called My Meno Plan. You all could just write it down and Google it, but it actually goes through things that are happening in your life, individual to you, and make recommendations and triggers, you know, where you need to go, what you need to do. But it looked very good, and it looked something that had some evidence-based, you know, practice behind it. I can't stress enough the need in your 40s, 50s, 60s, right? Preventative screening has to do with not only breast cancer screening, cervical cancer screening. You need to do your bloods, get your baseline and stuff, see where you are. A big thing in the UK is also colon cancer screening and stuff. They actually send out things in the post to you where you put your stool sample and put it in a little container, seal it, and send it back, and they test for colon cancer. These are things I think Trinidad, they don't, or we don't, you know, focus enough on prevention. We're more than happy to deal with after the bus hits you, but we don't tell you move out of the way of the bus, right? So we need to fix that. You always, I mean, HRT, yes, you should consider it, and then you need the right advice with regards to the risks versus benefits. And we've touched on both a little bit, and you have to realize that, you know, you do not need to suffer in silence. And very many of you all are good candidates for HRT and may not even be aware of it. You women are very good at this, men less so. You support each other at all the times, you share your experiences, and you'd be surprised at how much, you know, you can actually impact the lives of your other fellow women. And I go back to I thought that was such a brilliant infographic. You live by the 7 pillars of wellness, right? That we spoke about, and the first one was nutrition and hydration, right? I could talk about 5 hours on that one. Good. So, in summary, I think you hopefully, I know we took a long time. I'm sorry for that, but I think you have a very, very good concept that this is not a very simple thing. This is not just about taking a tablet. This is about understanding what your needs are, specific needs are. This is about debunking a lot of myths and sort of things that say. And you know, the young lady who spoke about the GP who said you just stop it and go through things naturally. What we can do to help each other and help you sort of transition so you have a good quality of life, I think should be explored, and you do so in a sort of evidence-based way, right? So you know the pros and cons, but it comes down to personal decisions. I took a shot at my own self here: menstruation, menopause, and mental breakdown. Yeah, a lot of things start with mental breakdown. Right, thank you very much. I know we answered a few questions, and I know it's late. I could feel a couple more questions because I know we have the time. We will get knocked out again. But anybody have any burning questions? I'm more than happy to answer. And I think Natasha.
Yeah, no, before you do, Doc, please let us know where people can find you if they would like to book an appointment, or before please go to the questions. Yes, so
I incorporated a little company called Serviam, which means I will serve. And I'll give you a number, which is I'll give you 2 numbers, in fact. It's 725-8979. That's to make appointments. And one of the things and one of the privileges I give my patients is that they have my number to WhatsApp me on, and that's 739-4646. You all can post it on your groups as well, because sometimes they might just have a little question, and I'm happy to feel that some of them need a more lengthy discussion, and they can come in. So those are the 2 numbers. I could leave that with you, Natasha, and in the end you could put it on your respective groups as well. Yeah, I'm more than happy. All right, just bear with me if I'm operating or doing something I may not answer right away, but I will answer. Yeah. Any questions on that? I did 22 slides with the intention of spending 22 minutes. So much for that.
My question, Doc, would be for your fellow practitioners, other physicians. What do you think we can do as a support group and advocacy group to encourage the medical profession to pay more attention to persons in menopause?
Right. So that is where it gets a little bit tricky. Unfortunately, I think whereas in other places, for example, in the UK, the GPs are regulated to the point where they have to actually maintain their accreditation, they have to do exams, they are appraised, they are assessed. So a GP who trained in 1980 and graduated is required to have annual or twice, every 2 years assessments. A GP trained in Trinidad and has been practicing wherever, right, has not changed practice since 1980s. And the problem is, whereas there's a big focus on continuing medical education, a lot of what happens in this country, right, is that there is little or no improvement in terms of how medicine is practiced. So a lot of the things that I discussed, if you ask GPs about Livial or Tibolone or HRT, they can't answer, and they will just make something, why you need that for, whatever else. Even some of the specialists that haven't changed or haven't gone abroad and done courses or whatever else, unfortunately, they will still say the same thing, and they're not as considerate as they should be, simply because they do not know. So it is the onus of the respective doctors or healthcare providers to educate themselves, and it has to be driven by the patients who keep asking questions and keep inquiring. And if you're not happy with the answers, you don't accept it blankly, you find another way, right? And then you will tend to find those that are basically not improving themselves will get left behind. Nobody will go to them, because all they're saying is, what they're saying is basically not evidence-based, and not true even, and even dangerous in some cases, all right? So I think the impetus has to be from you all. In other words, the women in this country, the bottom line is, the women in this country have to demand more. Full stop. Men are not going to advocate for you. Or not, maybe one or two, right? But you all have to demand that. And you have to drive this. There are so many different societies, organizations who will lobby, who will write the minister and say, look, we only have one form of HRT, right? And half of 1.2 million people, well, and you take out the children and that sort of thing. So many are suffering, and we need to do something about it. We want to engage in discussion. We want to boost the formulary, figure out a way for us to do this. How can you help us? I think it has to start, and the change only starts at that level, but it's driven by what starts at the lower level. I don't know if that helps.
Absolutely. Thank you very much for that. And that is part of the reason why we started this group, because we hope to do some of that advocacy on behalf of our members and all menopausal people in Trinidad and Tobago. So I think, how much time do we have, Indira? How many questions you think we can take?
Well, the timer didn't go down to 10 minutes yet, so I think we have probably at least 20-25 minutes.
All right, so if you have any questions, just raise your hand and we'll get to you.
I think we answered quite a lot during the presentation.
We did.
Yeah.
And so far, the response from some of the persons they're very thankful for this very informative session. And indeed, it was so.
I saw someone said for the next session, or if we have a next session, they would like to hear about endometriosis.
Oh yeah, we have 2 textbooks of obstetrics and gynecology we can talk about. Don't worry about that.
Someone did ask about merino.
Right.
So they said that they were bleeding heavily for an extended period, and they had the merino put in, and it really did help. But what are the implications for that, as they've had it in for a year now?
But it is how old are they? And the Mirena is actually designed, it has enough hormone in it. It's licensed for 5 years. It has enough hormones for 7. So if it was used as a means of helping with heavy menstrual bleeding, they keep it in for the 5 years. And if you're 45 and it takes you to 50, you're knocking on the menopause, you will avoid a hysterectomy. The Mirena has dropped hysterectomy rates worldwide. So in this country, again, I'm belaboring a point, is that if you have the Mirena and there is no cancer, then you can have a couple of marinas, and that takes you to your menopause, and you preserve your womb, you preserve your ovaries, and you transition without any sort of major surgery. There's a disturbing sort of trend, unfortunately, where, oh, your period's heavy, right, 3 months now, you need a hysterectomy. That's poor practice. That's not evidence-based, right? But there are different motives for driving that sort of decision. So again, women need to be informed. Yeah.
We have a question in the chat from Carissa. Now, I think this question is, and you can correct me if I'm wrong, Carissa, but I know there's some people who are very skeptical of pharmaceuticals and are looking for natural alternatives. So she's asking about Chinese medicine for perimenopause. I don't know what your views on that.
Yeah, so the problem is that anytime you have any sort of, put it this way, if I gave you a bottle, right, and in that bottle is a liquid, and I just said it cures menopause, all right, would you drink it? And
Yes.
if you ask somebody what is in it, and they say, no, this will fix you, would you drink it? So here's the thing. The vast majority of these supplements, yes, they have a good basis, but we're not 100% sure what it is. So you have to be very, very discerning. You have to be very, very careful, right? We have a lot of counterfeit stuff, right? Put it this way, I was just reading an article, the olive oil that is being sold, right? Oh, sorry, avocado oil. We think it's avocado oil, and when they actually tested it, it was a mixture of canola and grapeseed oil. And these are manufacturers who are doing this on a large scale. The way the world works today, unfortunately, at the risk of being cynical, is a lot of what is being advertised is false. So if that is the case, and I have something in front of me that says this does X, I have to know exactly what X is. What are the side effects of X, whether it's going to work. And unfortunately, Chinese medicine may not actually tell us a lot of that. I have an affinity for Ayurvedic medicine, and I do believe in a lot of herbal sort of things, right, that do have an effect. Things like turmeric, for example, has been tried and tested. It switches off the genes that trigger cancer. It switches off the genes that cause asthma. It switches off the genes that cause depression, and there's hard evidence for that. So I would tell everybody, eat saffron, turmeric, drink turmeric tea and ginger. That's what all of you all should go and drink tonight. So there are certain things that, yes, I have an understanding of it, and I inquire myself and do my own research, which I encourage all of you all to do. And there are things that are a little bit dodgy that I wouldn't actually expose myself or anybody else to, right? If I want to see if this works, I'll tell Indy, you try it first and see if it worked now. If you feel better, then I will try it. Okay, right? But there's a lot of things I think that don't work. And my worry is that it will actually cause more harm. And that is where you have to be very, very careful of what you put into your body. I don't have information, unfortunately, with regards to Chinese medicine and HRT, but I'm sure Chinese medicine has something to help with HRT, right? But I can't really say for sure to use this, use that, use the other.
I hope that answers your question, Carissa. Any other burning questions? Lisa says she's gotten some small red spots on her body, similar to moles. Might this be related to a hormone deficiency?
So Lisa, my car has a knock in it. What do you think it is? So the problem with that, my dear, is that there's so many different things. It could be bed bugs, it could be whatever. You need to probably see somebody to ask to have a look at it. And then skin conditions are very transient. Sometimes if they persist, you need to have it looked at. But we can't diagnose that over the Zoom meeting, unfortunately. So good, but not that good.
Fair enough. I had another question, Doc, in terms of research, because I think, I mean, I've heard coming out of America and the UK that certain populations of women across the world experience menopause differently. So, for example, on the continent, in Africa and in Asia, their symptoms are not as intense as Black people in the Americas. Can you speak to that, or is there anything that you know of anybody doing any research on how menopause impacts on Caribbean women?
Right. So here's the thing. Does food vary between cultures? Absolutely. Right? So if the American diet is a choice of McDonald's and KFC and Subway, where are the vegetables? There's none. Or little bit. People actually justify to me that they ate Subway and the 2 little pieces of cucumber is their vegetable quota for the day. If you sit down with folks in Italy and Greece and stuff, and their diet is a Mediterranean diet, you have vast amounts of everything from olives and different types of veggies and different types of things, you know, so everything there. Then how they will experience a menopause will be quite different, simply because their diet is filled with phytoestrogens, not so. There is nothing in the
And they're more physically active as well.
And
you know,
yes, I mean, they're in the sun all day and they walk to where they have to go, etc., etc. Whereas the American and sedentary lifestyle and the African Americans, unfortunately, are deliberately targeted by these sort of companies where fast food is basically the easiest and simple things to do. That's why it's the African American population, the Mexican population, where they're all suffering with every single chronic disease under the sun, right? But in places like Scandinavia and all that, in the UK and stuff, they are a little more conscientious, because if you go into one of the Burger Kings or even the KFCs or whatever, they have a vegan menu now. They have plant-based products and stuff. That's part of it. But they also do things like they must put the amount of calories in the food and stuff. So they're highly regulated because they're trying to dissuade the population without affecting commerce to that great extent. So it becomes a choice. And like I said, you have to curate everything that goes into your mouth, right? If you eat anything that is not good for you, your body is going to complain. And when your body complains, you look for a tablet to fix it, and you don't go back to the food that you put in your mouth. You can't put mud in a gas tank and expect the car to run. It's as simple as that. Yeah.
I think we have one final question. I will give this over to Gillian Smith, who is one of the co-founders of the Women Warriors in Menopause group. Gillian, you have the final word tonight.
Nice to meet you, Gillian.
Coming off mute. Quick, Gil. We're running out of time. Gillian?
Oh gosh. Yes, I'm so sorry. I'm still at this funeral. Oh my God. Anyway, you know, this is very fascinating to me, and this is one of the reasons why Natasha and I started this group. I think there are a lot of women in denial in terms of where their body is and what their body is telling them, because I've realized I have to eliminate stress in my life. And I started that journey by leaving my job, because my job does not take into consideration that a woman goes through menopause or perimenopause, and certain functions that they would have done in the past that they would have done quickly, like the brain fog and, you know, all those things could affect them. And, you know, it's just to get the ladies. Yes, we have about 500 followers on the actual Women Warriors. We have 50 people who are actually willing to give up their time to listen, to seek the help and that kind of thing. What do you think we can do to get the others on board to actually speak about this and not think it's a taboo and say, oh, nah, nothing is happening to me. But every Monday morning they're angry and they vex with the world. And that is something that is going wrong, because you were never angry 10 years ago or 5 years ago. So what do you think we can do to really get them to open up and to understand this, and that this is important?
Yes.
Because if you don't deal with this now, next 10 years, they might get cardiovascular disease. They may suffer from other ailments when it is, they could have nipped it in the bud, or, you know, do something to help their transition become a little easier.
Right. So one of the things I mentioned that is happening in the UK is, aside from the social media, where you have a lot of the silent ones who will listen and whatever, and they still continue and they don't make the effort. So I think what happens is in meeting people, you bring them out of their shells a little bit. So that's where the menopause cafes come in and stuff. And you will have a wide cross section. If you have as much as 500 across the country, there's no reason why you can't identify places. And I'm giving a plug for Fresh Press because they're a nice little cafe right there, right by where I live in Coquet. Where you try to reach the people in that vicinity, you plan in advance. You could do it after the work because everybody, that sort of thing. But you have to try to capture those that probably won't actually say anything and just suffer in silence still, but yet be a part of the group. But the thing is, you have to want help to get help, right? There's so many people, so many women even, that will a myriad of problems and stuff, but they don't do anything about it because they believe this is the best that they can have, or this is their circumstances, and etc., etc. But that mindset has to change. We actually have to try in our lifetime to change our culture, right? And this is a culture, unfortunately, where I don't think women are treated right with the dignity and respect that they deserve, and they're made to feel subservient and made to feel that they don't matter. And that has to change, but the driving force has to be other women. Men are not going to do that for you all. You have to look after your own, right? So any mechanism you can use, right, to do that, I think it's important. And do you know, okay, this is a little story, I'll end it. There was a time where there was a storm somewhere across in the coast of Maine, and a whole set of like the clams and shells were washed up onto the shore. But as the waters receded, right, all of these little clams and oysters would die because they need to go back into the water. There. So a little boy was walking across the beach, and he was taking one at a time and throwing it back in the water. Right? So an old man walked up to him and said, but there are 1 million of these clams here, right? What are you going to do? How on earth are you going to make a difference to 1 million of these things? And the little boy looked at him and he said, I make a difference to this one. And he throws it back in the water, right? We fix this world one person at a time, right? And if you can capture that one person and that person captures another, that's how it catapults. Right? I don't think we can get en masse somebody to form a movement and whatever else, right? But we have to do one person at a time. And every interaction you have, every patient that I see is an opportunity for me to try to make them feel a little bit better when they leave that office. And you have to do the same for your fellow women.
Thank you, Doctor.
Absolutely. Good. Thank you so much, Dr. Singh. I'm sure you'll be flooded with calls very soon. Come to see you. But again, before we cut off, we would like to extend our thanks to you and to you, of course, Indira, for hooking us up. And if we need your input, again, we'll definitely reach out.
Absolutely. I think we can do some more talks. And I think that things like polycystic ovaries, somebody mentioned endometriosis, all of these things, right? I think there's a lot of misconceptions, and I think we could try to make this, something.
Occurrence.
Yes. I think that will be worthwhile.
Maybe once a quarter or once a month, if you're available, we can certainly look at that.
Yes, that's fine. I'll make time. That's not a problem.
All right. Thank you very much to everybody who joined, and even those who
Thank you.
your absence.
Yeah.
Thank you so
much.
We still have about 40 that stayed, so that's pretty impressive.
Please go to Facebook and search Women Warriors and Menopause. Join the group, and there you will find all of the information about us and about the conversations we're having and what we have planned for this month. October is Menopause Awareness Month. The 18th.
It's also Breast Cancer Awareness Month.
Correct. And the two are linked, right?
Yes, absolutely.
We want to make October not just for breast cancer, but for menopause awareness as well. So join the group and follow along.
Absolutely. Thank you so very much for having me.
You're welcome.
Thank you. You're welcome.
Have a good night, ladies. Go and drink some turmeric and ginger tea.
Yes.
Thank you.